Why are doctors prescribing cycling? What's going on is that the world is currently drowning in an epidemic of preventable diseases from not moving enough. The World Health Organization estimates that not being active enough is the fourth biggest risk for death globally. It is responsible for 3.2 million early deaths per year. It's hard to understand the scale of a statistic like that. But you can also measure not just the number of deaths but the impact those deaths and illnesses before them have on society too. According to the World Economic Forum, 500 million people will be seriously sick from inactivity by 2030. Research published in The Lancet by Santos et al. Predicted that the economic cost of this illness would be $500 billion globally by the end of this decade. Even this unbelievably large number seems relatively conservative. According to the Centers for Disease Control and Prevention in the U.S. alone, inactivity costs healthcare $117 billion per year. So the scale of the problem is huge. What can then be done about it? Well, the World Health Organization has analyzed lots of scientific research out there and figured out that beneficial activity is at least 150 minutes per week. That could be gardening, walking, and at the top of the list of course is biking. So that is the aim, to enable people to do just over 20 minutes of activity per day. Cycling benefits. And what are the benefits of this biking? You can reduce your risk of getting type 2 diabetes by up to 40%, heart disease by up to 35%, some cancers by up to 30%, dementia by up to 30%, depression by up to 30%, and the risk of all-cause mortality by, you guessed it, up to 30%. 150 minutes of activity per week will help people live happier, higher quality lives for longer. Get a bike. So, doctors can prescribe biking to help remove barriers to one of the best forms of exercise. But what if you don't live in an area or country that offers this service? Well, the first hurdle to overcome is of course getting a bike. Now I think any bike will do. Of course new bikes can be very expensive, but they don't have to be. There are also lots of options for getting hold of old fixed-up bikes, maybe for free from a charity or used bike shop. Or check places like Facebook Marketplace or websites with people looking to clear out space and pass on old and loved bikes. Find places to ride. Once you're rolling, you then have to find somewhere to ride, which isn't necessarily easy. One of the biggest factors holding people back is a lack of anywhere safe or nice to exercise. Or it might even be a case of just not knowing what is out there for you. Staying away from cars and traffic is what you want to aim for. Check Google Maps to see if there are any green spaces or paths near you that you can use. At first, you don't need much. A small park that you can do laps on would be a great place to start. Not only is it away from traffic, but you can also quickly see your progress from 1 lap to 2 laps, 3 laps, 4 laps. And then not only do you start to build fitness, you can also build your confidence in safety. Ultimately, as you get stronger, you can then start to use your bike to take you to new places to keep your motivation up. Or for practical purposes like riding to work or riding to the stores. Set cycling goals. By far the hardest part though is simply getting out there. And this is never easy, but there are maybe a few steps you can put in place to make it a little less difficult. Beginning with goal-setting, work out where you want to be and then take small steps to get there, gradually building up just a few minutes at a time. Then there's also sharing that goal with someone else so they can help motivate you, maybe even meet you out there. There's nothing better than exercising with someone else. You also know that if you don't get out there that day, you'll be letting them down. Lastly, you can also use the power of technology. There's loads of apps out there that can help motivate you too. Something like Strava, which uses your phone as a GPS device to keep track of where you're going, how far, and how long. So you can see exactly how well you're doing each and every week. Cycling initiatives. While getting people active ultimately comes down to individuals, the fact that we're in this situation is not down to individuals. There are so many factors that make people inactive. And it's fascinating to see what countries, governments and local authorities are trying to do to help fix this. From successful initiatives like Couch to 5K to mass media campaigns to raise awareness and inspire people by sponsoring pro cycling teams like the UAE. And those urban planning initiatives to help get people access to safe, attractive places to exercise or bike infrastructure to reduce car dependency by helping people walk or bike instead. There have also been really successful initiatives that promote walking and biking purely as recreational activities too. For example, Bogotá in Colombia between 7 a.m. and 2 p.m. every Sunday, 75 miles of roads are closed to traffic and opened up for people to walk, bike, rollerblade, whatever. It's been going since the 90s and is more successful than ever with 1 million people taking to the streets each and every week. While prescribing biking is a great step to helping people, with the right political mindset, goodwill and dare I say courage, incredible things could be possible too. As always, you can make your voice heard. Writing a letter to authorities is never time wasted. You don't need that many people to voice their opinion for it to be considered influential. What do you think about prescribing biking? Is it the right thing to do? Is it enough? What else can be done? I'll be very interested to read what you have to say.